Hello, my name is Noor Shaheen. My student ID is 3044228. I am in NFDN 1002 A01. I am with Beth and Morgan, and this is my CIA skill video. This is my student ID up close. And in this video, I am going to show the skill portion of my CIA. I'm going to start by showing you a 360 view of where I am right now. So basically my med cart and my patient's room. So starting by my med cart, this is my org plan and some notes that I need. That is the only thing I need when I go to my patient's room. My calculator, scrap piece of paper, hand hygiene, and little post-its, and tray, med cup, and a label. And then this is the cup that I'm going to use to place my phone when I'm in my patient's room. Speaking of patient's room, we're actually going to move on to that. And this is my patient's room. This is my patient with his left forearm, where I'm going to be applying one of the medications. And this is my patient ID that I'm going to use to verify him. And this is all the supplies that I need. So a towel, water, hand hygiene, temperature and pen light, blood pressure cuff, gloves, and my stethoscope. So this is a view of what my patient room looks like and all the supplies that I need. And this is my MAR. This is my medication room, sorry. So right now I am in my med room, and I'm going to start CIA. So starting CIA right now. Okay, so I have received the doctor's orders. So Dr. Brown prescribed 2 medications for Mr. Tom Ford. Mr. Tom Ford, 157 centimeters, 80 kilograms, patient ID 4545. He's a male. And based on these 2 medications, I have come up with my own org plan, which will basically help me achieve my client-centered outcome, which will basically promote wellness and will basically make my client have less pain or be pain-free. And in this case, my client-centered outcome is basically that after 1 hour, I want my patient to report 1 out of 10 pain to left forearm. So we're gonna work on that. So I'm gonna start by actually taking my org plan, my pen, and moving on to my patient's room. Okay. Knock, knock. I'm knocking on the door. Hi, Mr. Tom. How are you? I'm performing hand hygiene, providing privacy. My name is Noor. I'm gonna be your student nurse today. How are you doing? You're doing great. Besides that pain in your forearm. Yeah. Okay. Which is why actually I'm here. I'm here because of your pain, and I just need you to quickly verify for me your first and last name. Tom Ford, 24 June 1938. Okay, perfect, Mr. Tom. I'm just going to ask you a couple questions before we start to see how alert you are, basically. Do you know where you are right now, Mr. Tom? You're in the hospital. Okay, perfect. And do you know what season it is? It is summer. Yeah, you're right, honestly. We barely have summer in Edmonton, but it's here, right? Perfect. It is summer, correct. And do you remember who I am? Yes, I am Noor, your student practical nurse. Not a lot of people actually remember my name, so good job on that. So yes, I am Noor, your student practical nurse. And do you know who you are? Tom Ford. Okay, perfect. Alert and oriented ×4. You just answered them perfectly. Thank you, Mr. Tom, for that. Mr. Tom, I'm going to start by explaining to you, basically, we want to reach an outcome here. I want to help you with your pain. I don't want you to be in any more pain. And I know it's bothering you. You told me what happened? You were with your daughter and a bee stung you. Yeah, it's painful and bothering you. Okay, I understand. Which is why I'm here actually. I'm going to give you the 2 medications that you requested, and hopefully they will help you. I'm just going to start by explaining to you that I'm going to take a set of vital signs. A set of vital signs, Mr. Tom, actually means that I'm going to basically see how overall you're doing. I'm going to take your heart rate, your blood pressure, respirations, SpO2, like which is the like how much oxygen you have in your blood right now. Is that okay with you? Is it okay for me to do it this time? Okay, perfect. Is it okay if I move the bed to my working height? You're just gonna feel a little bit movement. I'm just moving it to my working height so that I'm not bending down. I'm gonna move one side rail down so that nothing is in my way. And then I'm gonna take vital signs. So I've done that. I've taken all the vital signs that I need. So I have my results. Okay, Mr. Tom, so your BP was 130/80, lying down, and your respirations were 18 breaths per minute, which is within the normal range, non-labored and deep. SpO2 was 98% on room air, which is within the normal range. Heart rate was 98 beats per minute, regular and strong, which is within the normal range, but it was a little bit high. Yeah, but don't worry, we will work on that, okay? Temperature is 37.3 orally. Okay, perfect. So I have taken all the vital signs, Mr. Tom, and right now what I'm actually going to do is I'm just going to quickly do basically pre-assessments before administering your medications. Is that okay with you? Okay, perfect. I'm just going to ask you, do you have any allergies that I should be aware of? Okay, you're allergic to penicillin. Okay, and what happens usually like when you're in contact with penicillin? There's a rash. Okay, perfect. Okay, so I have done allergy and reaction to allergy. Okay, and then I just want to do a pain assessment quickly. I won't take long, I promise. I just want to ask you, when did your pain start? 30 minutes ago. Okay, and do you know what exactly makes your pain worse or better? Do you know? Pressing on it makes it worse. Okay, and how would you describe the quality of your pain? Stabbing, throbbing? It's a stinging pain. Okay, and where exactly is your pain? Like what region? It's in your left forearm. Does it usually move or just stays there? It stays there, okay. And how would you describe the severity of your pain? 2 out of 10, okay. And then the treatment and time you said it started 30 minutes ago, is that right? Okay, perfect. And the treatment, we're giving you, you requested Benadryl and an ointment, Bactroban, is that right? Perfect. And do you understand what's causing your pain? What's causing your pain is the bee sting. Okay, perfect. And what would you want your values to be? Like, what's so important to you right now? You want your pain to decrease, maybe to 1 out of 10? Okay, perfect. We can definitely try that. I just wanna, so I have done basically, Mr. Tom, thank you for answering all of that. I have done my pre-assessments for the first med. So the first med is actually, I just want to talk to you about the reason why we're giving you Benadryl. Benadryl is gonna basically relieve the allergic symptoms, which is caused by the histamine release in your body. So what's gonna do is it's gonna relieve these symptoms and you won't feel as much pain anymore. Okay, and with this medication there might be some side effects that will affect your lungs. So do you mind if I just quickly assess and listen to your lung sounds? Is that okay? Okay, perfect. I'm going to clean my stethoscope and then I'm going to listen to your lung sounds. Okay, I'm just going to explain the procedure to you really quickly, Mr. Tom. So whenever I place the stethoscope on your chest, I just need you to take in a deep breath in for me. Whenever you feel like you're dizzy or you want to stop, just let me know right away, okay? Okay, perfect. Okay, I did not hear anything, no crackles or wheezing anteriorly. Okay, Mr. Tom, that was great, thank you. Can you just tip on forward for me so that I can listen to your back? Okay, perfect. I will help you, don't worry. Okay, so no adventurous sounds, crackles or wheezing as well when listening posteriorly. Okay, thank you, Mr. Tom, for that. And right now I'm just going to do the second basically pre-medication assessment. Is that I want to position you basically in a position called semi-Fowler's, which is basically, without like using the fancy term, is basically like you sitting right now, like 45 to 90 degree angle. Are you comfortable? I'm just gonna move the bed a little bit. Are you comfortable like that? Okay, perfect. I'm going to position you here, and I'm going to have your left arm actually resting. Okay, resting like that, yes, so that when I come to apply the cream, your arm is ready. Okay, and then I'm going to speaking of your arm, I'm just going to assess this lesion before therapy. I'm going to assess and look for redness and inflammation. Okay, I'm just going to do a quick inspection. I see some redness and some swelling. Okay, so I have done my pre-assessment for the ointment, and then I'm going to do my teaching relating to my nursing diagnosis. Okay, Mr. Tom, so right now I'm just going to teach you something very quickly. You told me it hurts when you press on it, so I'm going to teach you how to basically sit without your arm being next to you so you're not pressing on it. And I'm also going to teach you how to remove any clothing so that it stays open in the air. And I'm going to teach you how to safely move it so that you're not, you don't exert any more pain. Okay, Mr. Tom? Do you mind if I touch you? Okay, perfect. So basically, Mr. Tom, what you want to do is you don't want to like carry anything heavy with it. And you want to move it a little bit away from your body and rest it on a pillow. I'm going to grab a pillow for you to rest it on so that it's just lying there for me to do the treatment, and it's not under you or you're not sleeping on it, so that, well, because when you do, it might cause some pain. Okay, did you understand my teaching? You want me to you want me to show you how to? Okay, so basically right now you're sitting like that on the bed, you're sitting on TV. I don't want you to be putting it like on your stomach where it's covered by clothing. I want you to put it just on the side, just like that. I have the pillow for you, and rest it on the pillow just like that, so that you're not exerting. Rest it on the pillow just like that, so that you're not exerting any more pain on the lesion right here, and you're not, and the clothing is not restricting. Okay, so I've done my teaching regarding that. Okay, Mr. Tom, so I have done all my pre-assessments. I will leave right now. Actually, I'm just going to put the bed, I'm just going to move the bed to the lowest position for your safety, Mr. Tom. You're gonna feel a little bit of movement. Lowest position. I'm gonna put the side rail up. You want the TV on? Okay, perfect. I'm gonna open the TV for Mr. Tom, for you, and then I'm going to tuck you in bed just like that. I have your hand rested on a pillow, and then your call bell, just hit it whenever you need me. Okay, Mr. Tom? I will be back with your 2 meds. Okay, I'm gonna perform hand hygiene, and then I'm going to leave the room, provide privacy, and then go into my medication room. Okay, so right now I am in my med room, and I'm going to start by performing hand hygiene because we want to make sure that the med room stays clean. I will grab my MAR and my doctor's orders. Okay, I'm going to do a quick verification so that I make sure that everything on my MAR is correct and accurate. Tom Ford, 24 June 1938, 24 June 1938, Benadryl liquid, 25 milligrams, oral, every 4 hours, PRN, Bactroban, 2%, ointment, topical, 3 times per day, PRN. So the doctor's order says apply to affected area, leave to open air. Okay, perfect. So right now I don't need my doctor's order at this point. I have done my verification. I know everything on my MAR is correct and accurate. I'm going to start by taking out my first med. I will make sure it is the med that I need. It is Benadryl, and it is 12.5 milligrams per 5 milliliter. Okay, perfect. And I have actually labeled it so that I can perform my checks, and it is for my patient. Okay. I'm just going to do a quick calculation because the doctor ordered, according to my MAR here, is 25 milligrams, and it is available as, so I will do the ordered dose, which is 25 milligrams, divided by 12.5 milligrams, what's available, multiplied by the quantity it's available in, which is 5 milliliters. The milligrams will cancel out, leaving me with, this is 2, multiplied by 5 is 10 milliliters. I'm just going to use the calculator to double check my work because it is very important to always double check your work. 2 multiplied by 10 is 2 multiplied by 5 is 10 milliliters. So I need 10 milliliters of this medication. So I've done my calculation. I'm going to set that aside and remember that I need 10 milliliters. I have my paper next to me. So I'm actually going to start by performing my first check. Right patient, Tom Ford. 24 June 1938, 24 June 1938, right medication, Benadryl, liquid, right dose, 25 milligrams, right route, oral, right time and frequency, every 4 hours, and the reason for this medication is to relieve allergic symptoms caused by the histamine release. Okay, so I know the reason, and I have done my first check that includes my 5 rights. I'm going to move it onto my palm to move on to my second check. Right patient, Tom Ford, 24 June 1938, 24 June 1938, right medication, Benadryl, liquid, right dose, 25 milligrams, oral, right route, right time and frequency, every 4 hours PRN, I have checked my MAR, it has not been given yet, so I am safe to give it. Expiration date is June 2030, so it is not expired, so I can give it. Right now is I will actually grab my med cup. I will make sure not to touch it from the top, not to contaminate it, and then I will open my medication, making sure not to contaminate the top, and I will pour out, according to my calculation, exactly 10 milliliters. Making sure not to contaminate any of the top parts. Pouring out 10 milliliters at eye level to make sure that I don't go above 10 milliliters. Okay. I have exactly 10 milliliters right now. Being aware not to contaminate it. And then I will label the time it was opened, today's date, and my initials, so that the next person knows. But in this case, I don't need it because it's specifically for my patient. Okay, and then I have created a label specifically for this med cup. I will put it away from the 10 milliliters. And then I will perform my third and final check. Right patient, Tom Ford, 24 June 1938, 24 June 1938, right medication, Benadryl, liquid, right dose, 25 milligrams, right route, oral, right time and frequency, every 4 hours PRN, this has 10 milliliters. I've made sure it has exactly 10 milliliters. And now I have done my third and final check. It says allergies penicillin, so I've made sure that there's no penicillin in this medication. And then I will grab my tray, and then I will put my medication on there. Next thing that I'm going to do is I'm actually going to use my MAR to read Bactroban 2% ointment topical 3 times a day. I'm going to open my med cart and look for Bactroban ointment 2%. Found it, and then I have labeled it specifically for my patient. I will perform my 3 checks right now. Right patient, Tom Ford, 24 June 1938, 24 June 1938. Right medication. Bactroban, 2%. Right dose, 3 times a day. Right route, ointment, topical, so the right route is topical. I've made sure. And then right time and frequency, 3 times a day PRN. Right time and frequency, 3 times a day PRN. I will move it into my palm to know that I'm doing my second check. Right patient, Tom Ford, 24 June 1938, 24 June 1938. Right medication, Bactroban, 2%. Right route, ointment, topical. Right dose, 3 times a day. Right time and frequency, 3 times a day PRN. Okay, perfect. That was my second check, and then I'm going to grab my trays next to me to know, so that I know that I'm moving on to my third check. Right patient, Tom Ford, 24 June 1938. Right medication, Bactroban 2%. Right dose, 3 times a day. Right route, topical. Right time and frequency, 3 times a day PRN. Okay, and when it comes to specifically like the dose of this ointment, you just put like a little bit on your fingers, and then you rub it together and you put it on the site where the patient is complaining. Okay, and then I'm going to grab my MAR. So I've done everything, my pre-assessments. I made sure I've done my pre-assessments. So 2 medication pre-assessment, teaching, and my nursing assessment relating to medications. And then I'm going to grab my medication tray, my MAR, and my work plan. Okay, I'm knocking on the door. Hi, Mr. Ford. How are you? It's Noor again. I'm here with your 2 medications. Yes, I am Noor, your student practical nurse. Mr. Tom Ford, is it okay if you just please verify your first and last name, Tom Ford, and your date of birth, 24 June 1938. Perfect. So I have verified it on my MAR that I have the right patient. Okay, Mr. Tom. Okay, perfect. So right now I have the 2 medications that I told you that we will give you. But before I give you them, I just need to do a quick education before we start, okay? Just a little conversation. It won't take long. Okay. Okay, Mr. Tom. So for the first med, which is Benadryl, so the reason we are giving you it is to relieve allergic symptoms, So these symptoms are causing you pain. So when we relieve them, you won't feel as much pain anymore. Okay, and so I told you the reason for the Benadryl. So when it comes to the Benadryl, some side effects may include drowsiness, dizziness, or headache. Is that okay? Okay, these are some side effects that may or may not occur, just so you know. Okay, and for the second med, actually, the reason why we're giving you it is to basically prevent any bacteria to grow on the lesion, and to basically help calm down the itchiness and the redness and swelling of that lesion. So that's the Bactroban ointment that we're giving you, and some side effects may include burning or itching, which may or may not occur. Is that okay with you? Okay, perfect. And after I've done my education, I just want to ask you, are you okay with taking Benadryl right now? Okay, perfect. Yes, you are. Are you okay with taking the ointment Bactroban? Yes, you are. Perfect. And are you okay with taking both medications at the same time? You are. Okay, perfect. And okay, so I have done my reason, education, refuse. And right now I'm actually going to do, just give me 1 second, Mr. Tom. I'm just gonna do the last and final mini side bed check. I'm just going to check these medications, okay? I'll be right with you. So I will hold the cup from the bottom, make sure not to contaminate any areas, and do the final bedside check. Right patient, Tom Ford, 24 June 1938, 24 June 1938, Benadryl, right medication, right dose 25 milligrams, 25 milligrams, right route, oral, right time and frequency, every 4 hours PRN, every 4 hours PRN. I do have 10 milliliters right now in this cup. So I've done my last and final check, and I'm going to grab the ointment, and I'm going to do my last and final bedside check. Right patient, Tom Ford, 24 June 1938, 24 June 1938. Right medication, Bactroban 2%, Bactroban 2%. Right route, ointment topical, right dose 3 times, right time and frequency 3 times a day, PRN 3 times a day, PRN. It has not been given, and expiry date, it expires June 2030. It is not expired, so I am safe to give it. And then the other medication, it expires June 2030. It is not expired, so I am safe to give it. So right now at this point, I'm going to perform hand hygiene. Mr. Ford, is it okay if I raise the bed to my working level? I'm going to raise the bed to my working level, put one side rail down, and I've performed hand hygiene. I've provided privacy, and I am ready to administer 2 medications. Okay, Mr. Ford, you're so okay with taking the Benadryl liquid medication? It is a liquid medication, so it requires you to swallow. Are you okay with swallowing? It will be some sort of like a thick liquid. Are you okay with that? So you're okay to swallow, you are safely. Can you just please swallow a little bit of water so I can just look at your swallowing? Okay, perfect. The patient can swallow, so I'm safe to give this medication. Okay, my patient has taken it. Okay, and do you need more water, Mr. Tom? No, you're good? Okay, perfect. And right now I'm just going to perform hand hygiene one more time, and I'm going to expose, I have already exposed the area where I want to apply the ointment. I'm just gonna do a quick, I have done a quick skin assessment looking for the lesion and basically looking for redness and swelling. There is redness and swelling present right now, and then I'm going to I performed hand hygiene, and I will put on my gloves. I will put on my gloves, and then I will take the medication. Actually, before taking the medications, what I need to do is I just need to clean the site and clean the area. So I will use a moist towel dipped in water. Is this temperature okay? It's not too cold? Okay, perfect. So the temperature is not too cold. And I will clean the site, making sure not to apply too much pressure. Cleaning the site, and then I will flip it to the other side and dry the area, making sure the area is dry. If there is excessive dryness, I won't dry it that much. There's no excessive dryness, so I can dry the area. I'm going to change my gloves, so take off my gloves, discard them in the garbage, and then I will don on new gloves. And then I'm going to take my medication. Okay, Mr. Tom, are you ready for the ointment? Okay, perfect. I will put like a line on my gloves. just like that. And then I would place it back, and then I'm going to rub it in my gloves so that it's not too cold. And then I'm going to apply it with with the hair growth. I'm going to apply it with the hair growth. Does it feel too cold? No? Okay, perfect. Does it itch or burn or anything like that? Okay. Okay, so I've applied it. Okay, Mr. Tom, I just need you to keep this area exposed, as we said. Okay, don't cover it. And I'm going to take off my gloves, discard it where it needs to be discarded in the area where we use gloves and use PPE. And then I'm going to perform hand hygiene. And then I'm just gonna put the side rail up, and then I'm going to tell my patient, I'm going to talk to you, Mr. Tom, about when I'm coming back. So I will be back in an hour to take a set of vital signs again, and then I will be back to evaluate you. So what I'm going to evaluate is I'm going to ask you about your pain level, and then I'm going to see how you're feeling in terms of that left forearm. Are you experiencing any pain after the ointment? And then I will ask you, if that's okay with you, to show me how to safely move your arm in order to avoid pain. And then I will also perform a respiratory assessment, listening to your lung sounds again. I won't take long, I promise. And then I will look at your lesion once again and looking for redness. Is that okay? So I will come back in an hour to do all of that evaluation. I'm just letting you know. And then hopefully our centered outcome will be reached, which is that you want your 1 out of 10 pain to be 1 out of 10 or less. Okay, so I will be back. I'm just going to put the side rail up, raise the bed to the lowest level for your safety, Mr. Tom. Is it okay if I lower the bed to the lowest level? And you want the TV on? Okay, perfect. I'm just gonna open the TV. I'm gonna tuck my patient in bed. And I just need you to keep that uncovered, just open in air, as we said, remember? Okay, perfect. And then I'm going to perform hand hygiene, provide privacy, and leave. And right now, I'm going to go to take care of other patients, obviously, and then before I could go back to evaluate Mr. Tom. So I've left the room, I've performed hand hygiene, tucked my patient, everything. Right now I will document on my MAR today's date, 18 June, and under today I will put my initials that I have given it. Okay, today's date, under today's date, 18, my initials that I've given Benadryl and Bactroban. So I have signed the MAR. I will put the MAR back. And then I will take my org plan an hour later to evaluate Mr. Tom. Okay, so I'm knocking on the door. Hi, Mr. Tom, this is Noor again, a very practical student nurse. I'm performing hand hygiene, providing privacy. Okay, Mr. Tom, so as I said, it's been an hour and I'm back here to evaluate you. Can you just please verify your first and last name? Tom Ford, 24 June 1938. I'm going to raise the bed to my working level so that I'm not bending down. One side rail down, but I will stay here. And as we said, I just want to quickly evaluate the effectiveness of the medications. So I will take a set of vital signs, Mr. Tom, if that's okay with you. So I have taken vital signs. Blood pressure is 125/88, lying down. Respirations are a little bit better, 16 breaths per minute, non-labored and deep, SpO2 98% on room air within normal range. Heart rate is a little bit lower and still within the normal ranges, 80 beats per minute, regular and strong. Temperature 37.1, which is good. And I just want to ask you now about your pain. So pain assessment after medication administration. Okay, so you said your pain started about like an hour and 30 minutes ago, and what right now seems to make your pain worse? You said it was like pressing on it, but right now what's making it better is not actually pressing on it. Okay, perfect. That's what we wanted, right? Quality, it's still, there's a little bit of sensation of stinging, okay? And your the region, it's still there, it's not moving, it's still in the left forearm, right? Severity, 1 out of 10. Okay, perfect. So reports 1 out of 10 pain, and you understand what's causing your pain, the bee sting, and what's your values right now. Your values right now is you want the pain to go all away, but it's good. That's 1 out of 10, right? Okay, perfect. Sounds good. So I want to ask you, are you experiencing any pain after administering of ointment? You're not? Okay, perfect. And so after, I just want to evaluate, how is it, putting your arm up or resting it under a pillow making you feel? It's better. It's not causing any, okay, it's not causing any more pain. Okay, perfect. So there's no increase in pain. And I just want you to quickly demonstrate how to safely move your left arm to avoid pain. Okay, so you're gonna grab a pillow with your other hand, you're gonna put it here, and then you're gonna put your hand slowly on the pillow. You're not gonna rest your arm behind you or anything like that. Okay, perfect. Demonstrate how to safely move the left forearm to avoid pain. And I'm just going to quickly reassess your respiratory system, as the Benadryl can affect your respiratory system. So whenever I place the stethoscope, I just need you to breathe in and out for me. If you want me to stop or you get dizzy, just please let me know. Okay, perfect. I'm just gonna ask you to lean a bit forward so I can listen posteriorly. Okay, there are no adventitious sounds, no wheezing or crackles upon listening to lung sounds. So there are clear lung sounds. And then I'm just going to quickly inspect and assess the lesion. So during therapy and after, right now I'm evaluating. There is some little bit of swelling, but the redness has but the inflammation has calmed down and it's not as red as it was. Okay, right now I'm just going to put the side rail up. Okay, Mr. Tom, that was it for me for today. I'm just going to place the call bell here. If you need me, just please let me know right away. I will come back if your pain increases or anything like that, and I will come back to give you your next set of medications 4 hours later. Call bell is in reach, side rails up, the bed is in lowest position, provides privacy. I'm going to excuse myself, perform hand hygiene, and then I'm going to go on to my documentation room. Entering my documentation room, I have performed hand hygiene, and right now I just need my PRN effectiveness record. Medication Benadryl, dose 25 milligrams, route PO, date today's date, time it was given at 8 a.m. I went to evaluate at 9 a.m. Reason, allergic reaction, pain from allergic reaction. Result, less pain. Reports pain 1 out of 10. My initials on both, I have signed it. And then medication, Bactroban ointment. So 3 to 5 times. And then the route is topical. The route is topical. It is an ointment. And then date 18 June, time 8 a.m. I've given it at 8 a.m. and I came back to evaluate at 9 a.m. Reason, so to prevent infection and to reduce bacterial growth. I have signed it, my initials. Result, so there is less itchiness and less pain. Reports pain 1 out of 10, and my initials. Okay, and I will also put that in my client care record. And that was it for my video. This is Noor Shaheen 3044228. That was my skill portion for Mr. Tom Ford. I hope you liked my video, and thank you for watching.